It's time for our Vidant Spotlight. In the Vidant Spotlight today, I'm going to make this work because she's been helping me practice her name. Dr. Wargoa Akram. How'd I do?
Pretty close.
But not exact. Dr. Akram is the assistant professor, colorectal surgeon at ECU and Vidant Medical Center. This is Colorectal Cancer Awareness Month.
Correct.
And this is, of course, an emphasis on colon health. And we are going to be telling you if you are at a certain age, and we'll get Dr. Akram to tell us about that, you need to get a colonoscopy.
Right.
I get mine on a regular basis. First of all, thank you for being here. How are you?
I'm good. Thank you.
All right, so tell us what colorectal cancer is.
It's colorectal cancer is a type of cancer that would affect mainly the colon, also the rectum, and we also touch on cancers that include the anal canal and the appendix.
All right, so who's at risk?
Everybody is at risk. Risk is different. Some people we call them average risk, and that's almost everybody. And then there is higher risk population.
And those wonderful colonoscopies, which, I mean, honestly, you know, we make jokes about the colonoscopy. There's nothing to it.
No.
There's absolutely nothing to it. If people who are afraid to get one, you need to not be afraid. But at what age do you start getting these colonoscopies and getting screened?
So till recently, we all knew about the 50 years old. This is not true any longer. We decreased it to 45. So this is for average risk. If you are a higher risk, you start earlier. Average risk, you start at 45. This is for everybody.
All right. So a colonoscopy, there's not much to it. I mean, there's a lot to it in terms of it maybe saving your life.
Yeah.
But in terms of what it's like for the patient, I mean, it's not an unpleasant experience.
No, it's a pretty safe procedure.
Yeah.
The hardest part about it is doing the prep. But doing a good prep will allow you to have a really good colonoscopy, and then the interval between any two colonoscopies for an average risk normal one is 10 years. So this is buying us 10 years. You'll be completely comfortable and asleep while the colonoscopy is done. It's an outpatient procedure. You'll be able to go home after that. The risks are very, very minimal.
Yeah.
And it could save us from even developing cancers, not finding about them.
You just need to plan in advance not to do anything the night before.
Yes, exactly.
Because you're going to be visiting the restroom quite a bit.
Because
that prep will make you...
And you start the prep in the evening, so you still have the whole day to enjoy it. And then the evening will be focused, okay, let me clean my colon. That's colon cleanse. And let's get the colonoscopy.
You know what? It's good for you to do that occasionally, right?
Right?
And getting your colon cleansed out is not a bad thing anyway.
I mean, some people just do it, but let's do it and get the colon checked.
Yeah. Am I right? The stuff that you have to drink doesn't taste as bad as it used to. Some of it does, but
they even have flavors now.
Yeah.
You could pick a flavor. There are multiple different options.
You can get lemonade flavor.
Yeah, it's if one option doesn't fit you, there are other options. There is a lot of options available. Just talk to your care provider.
So when you do the colonoscopy, what are you looking for? What are the findings that would lead someone or lead to a diagnosis that might be concerning?
So we are looking for polyps. And polyps are very small growth on the inside of the colon. You can't really see them. Let's say if you get a CAT scan and they are too small, you can't even see them. Those have the tendency, and they have types. And according to the types, they have the tendency of changing into cancers. It's not guaranteed that they are going to make a cancer, but the risk increases when you have them. And the goal is to remove them and get them out of the colon. And that could be done through the colonoscopy at the same time. That's why it's favored, because you find those polyps and you treat them. You're just not looking at them, okay, they're there, now what to do?
You know, I remember the first time I heard about colonoscopies was in the 80s. And I remember seeing a presentation at my Rotary Club in Chapel Hill, and this doctor came in and he talked about how he was going to put this thing into the colon. If there was a polyp in there, he was going to clip it off right there at that moment. And I thought, that's unbelievable. But I mean, that's what happens. I mean, if there is a polyp in the colon,
then you remove it.
You remove it during the colonoscopy, right? And then you test it to see if it's cancerous.
Exactly.
And most of the time it's not. Is that
Most of the time is not. Most
Yeah.
of the time is not. And some are just a little bit of an overgrowth of normal tissue. They won't even change the interval. Depends on the number of polyps that we find. If you don't have any polyp, we send you out for 10 years. Then depending on the numbers, we could decrease the interval to just take a look in less years to make sure nothing is growing back.
So, what are some signs to look for? Is there something that we can do as a patient to look for colon cancer?
So we want to find about it even before it gives you any symptoms. And that's the goal of the colonoscopy. And that's why it's important. When you are in perfect health, we still could have cancer developing that we don't know about. When it start giving us symptoms, it's got advanced a little bit, and now it's causing some bleeding with this stool. So anytime there is a bleeding with this stool, we need to investigate that. This is alarming. By far, it could be just a hemorrhoid, but we don't want to blame it on a hemorrhoid without making sure it's not coming from higher up in the colon. Weight loss, that's another big thing. Changing in the frequency or the type of stool you're getting when you're going to the bathroom. Anything that really it's out of normal, we need to investigate that.
So rates for colon cancer for African American men is higher.
Right.
Why is that?
A lot of reasons. I don't think we understand it completely right now, but we think it has a lot to do with the socioeconomic status, with access to healthcare, also the knowing about the benefit of colonoscopy and the having those colonoscopies done. There is a lot to it, but we have to be careful. The risk is higher. The risk is higher of having colon cancer to about 20%. So it's not a small difference. 20% is big, and it's hard to pinpoint it at only one reason. We just have to be more careful in assessing our African American population. The risk of death is even higher, unfortunately. So really, we have to be careful.
If you're just joining us, this is Dr. Wargoa.
Yeah, you got it.
Akram.
We got it.
Dr. Akram is assistant professor at ECU and colorectal surgeon at ECU and Vidical Medical Center, soon to be ECU Health.
Right?
Actually, it already is ECU Health. They just hadn't changed all the marketing on it yet, but it will be soon, according to Dr. Waldron, who was here on Friday morning. So how do we do in Eastern North Carolina? How do we compare to the rest of the country when it comes to colorectal cancer?
We form about 15% of North Carolina, of the cases that arises in North Carolina. 15% we find it here in Eastern North Carolina. From new cases and existing cases. Now, when it comes to death percentage is a little bit higher. We are at 17%. So we see more over here. We see more cancers. We see more advanced cancers. We see more early cancers as well. And it's really important to keep finding about
Is it because people aren't getting screened?
Has a lot to do with that.
How about, speaking of not getting screened, during the pandemic, people were not going out and doing these things like getting colonoscopies.
Right, yeah, right.
So have we seen any effect from the pandemic on an increase in the percentage of people who are getting colorectal cancer?
It's crazy, and I didn't really know the impact till I looked at the statistics. It decreased by 90% from the year before, 90. So we stopped elective procedures for about a month or 6 weeks, and then we went back again. But even with that, during the whole year of 2020, we fall into 90% less than 2019.
Wow. That's not good.
That's not good. Part of it is people being scared to come to the hospital. There is a lot that's happening in the world that is on your mind. And canceling and putting on cases, again, a lot of factors. I'm seeing it picking up again right now. So that's good. That's good.
That's good. So people need to get screened. They need to schedule those colonoscopies.
You need that colonoscopy done. Save yourself from having that cancer.
And 45 is the new age.
Yes, for average risk. Now, if you have a history of...
For average risk.
For average risk.
Right.
If you have a history of cancer in the family, then that age goes lower.
Right. Can we do anything in changing any lifestyle things to help us to potentially prevent colorectal cancer?
I always tell my patients, even after a surgery, it's all about balance and moderation.
Yeah.
Really, everything in moderation and with balance is okay. So we emphasize on healthy lifestyle, exercises, increase hydration, increase fruits and vegetables, decrease processed food, decrease meats, all the good things. They help. They truly decrease the risk. They don't prevent it though. So even if you are the healthiest person and following that diet, you still need your colonoscopy.
So, what kind of resources are available here in the Vidant system and around Eastern North Carolina for people who want to know more about this or need to learn more about it?
There is a lot of options for screening. Colonoscopy is one of them, and there are other options like testing the stool, doing the Cologuard. We should reach to your healthcare provider, and there is a lot of options that could be offered and that should suit everybody and everybody's needs. So just reach to your healthcare provider.
You know, I just had my semi-annual visit to my family doctor, and the first thing she does every time is say, okay, when did you have your last colonoscopy? She says it every single time. So, I mean, doctors are on it now.
Yeah.
And if you have not had a colonoscopy, they're going to send you to get one. And again, it's just a very simple procedure for the patient. People make a lot of it, but if you've ever had a colonoscopy, and I've had several now,
Yeah.
When you get to my age, you've had a bunch of stuff. But if you just go through this one time, you'll see there's just nothing to it for the patient. You don't even know it. I mean, you basically take a nap and wake up and it's over.
Yeah. It's the fear of knowing about the disease, but it's really a disease that we can prevent and we can treat. That's why we look for it.
And the thing about it is, am I right? If you don't treat it and you have polyps that grow into bigger polyps that are cancerous, I mean, it's a bad outcome.
It's going to show itself. We don't want it to show itself. We want to find about it before
we know I have
it does
friends who
that.
didn't go, and
Yeah.
they got colon cancer.
Especially in young people.
Yeah.
Especially in young people, we
Right.
see the incidence going higher in young people.
Yeah.
So we have
men
to be
and
vigilant.
women, 45 is the age?
Men and women 45, anybody with symptoms at any age. If you are 20 and you're seeing some blood, it could be your hemorrhoid, but now let's make sure nothing is happening in the
So
colon.
if you've got any symptoms or family history, you should go earlier than 45.
Right.
But at age 45, you should start getting screened and have a colonoscopy, how often?
Every 10 years, again, if you are average risk. Every 10 years.
And if you have polyps, now they send me in there. I've had polyps. None of them have been cancerous, thank goodness. But they usually send me back every 5 years.
Yeah, right.
Does that sound right?
Yes. If we find polyps, then the interval will decrease depending on the number of polyps. So anything less than 3 polyps goes 5 years. If it's more, even shorter than that.
Gotcha. Anything else you want to mention that I haven't brought up?
No, I think we talked about almost everything.
You're fantastic. Thank you for being
thank
here.
you for having me.
I wish I could pronounce your name correctly.
You
but
did it
I'm gonna
on the
try
second
it again.
try.
Dr. Wargoa
Yeah, you got it.
Akram.
Yep, Wargoa Akram.
Wargoa Akram, who is an assistant professor and colorectal surgeon at ECU, Brody School of Medicine, and Vidant Medical Center, ECU Health. Thank you for being here.
Thank you for
Great
having me.
to meet you. Good
Pleasure
information
meeting
for us
you.
this morning.